Hey, it's Dr. Modi from Gastro Office. Today I want to talk about treatment options for your reflux. Now, when you go to the grocery store, there's countless and limitless options for you to pick up. And so I think it's really important to know how these medications work and when it's appropriate to take them for you. So let's say you're a patient who has reflux symptoms maybe once a month. It's, your triggers, spicy food, a glass of wine. You may benefit from just an antacid. These are examples like Tums, Maalox, Gaviscon. They simply neutralize the acid, and if you have symptom resolution with it, perfect. Now, if that's not your case and you have more severe symptoms that happen 3 to 4 times a week, not always related to food triggers, you may benefit from a hydrogen blocker such as Pepcid or famotidine, and it blocks hydrogen from being produced from stomach cells. Now, some people are able to take this after meals and do just fine. Some people take it 30 to 60 minutes before a meal and feel that it helps their symptoms. By the time you come to see a GI doctor, you generally have tried, all of these derivatives over the counter. And your primary doctor has probably also put you on something called a proton pump inhibitor, such as pantoprazole, omeprazole, etc. And so the way to actually treat this, is that, proton pump inhibitor works at the cellular level. And so when it's cellular, you have to give it time to get absorbed. And usually I recommend taking it 30 to 60 minutes before your biggest meal of the day, especially if you have GI symptoms or reflux symptoms at nighttime. It may be beneficial, instead of when we typically recommend to take it in the morning, take it 30 to 60 minutes before dinner. Now, your biggest acid loads throughout the day are usually 1 to 2 hours after meals. By taking a proton pump inhibitor 30 to 60 minutes before a meal, it actually reduces that peak acid and allows you to have more relief. Now, there are side effect profiles with all three of these categories of medicines: the antacids, the hydrogen blockers, and the proton pump inhibitors. I have a separate video talking about the proton pump inhibitor side effect profiles, and I think it's a worthwhile listen. But, in general, we want you on the lowest dose possible of all of these medications. And that includes, working on lifestyle modifications as well, right? So, avoiding late night meals, because if you eat at 9 and then you have your highest acid load 1 to 2 hours after, and you go to bed even at 10, 10:30, 11, you could be experiencing reflux overnight. Maintaining a good, healthy body weight is important. Staying away from specific food triggers, all of these things are very important. Now, as gastroenterologists, we also do endoscopy, which is a camera evaluation looking at your food pipe or your esophagus, your stomach, and your small intestine. And this may be required if you've been on acid blocker therapy for several months without any benefit, and you've even timed it correctly and symptoms are not going away. It's important for us to look for things like inflammation, precancer cells like Barrett's esophagus, infections such as H. pylori, or cell changes in the stomach. So, I think if you go into the grocery store next time, look for these categories of medications and decide what type of, symptoms you're having. If it's, every day, it may be worthwhile to talk to your primary doctor or come see us here, at Gastro Office, and maybe we get you on a stronger proton pump inhibitor dose and take a look in your stomach. If it's, a couple times a month, maybe try an antacid or even H2 blocker as well, and, we can go from there.